This medication is used for a short time to treat occasional constipation, as it is a laxative that is thought to work by drawing water into the intestines, helping to cause movement of the intestines. It is also used to treat symptoms caused by too much stomach acid such as heartburn, upset stomach, or indigestion, as it works as an antacid by lowering the amount of acid in the stomach. The daily dosage for adults is 2 to 4 tablespoons, taken 1 to 4 times a day, as directed by your doctor. The best time to take this medication is either on an empty stomach or 2 to 3 hours after a meal. When taking magnesium hydroxide suspension, it's important to follow the directions for use. If you're using the chewable form, be sure to chew it thoroughly before swallowing. For the liquid form, make sure to shake the bottle well before each dose. Use a special measuring device or spoon to carefully measure the dose, and avoid using a household spoon as it may not provide the correct dose. If you're taking this medication for constipation, be sure to drink a full glass of water with each dose. The dosage of magnesium hydroxide suspension is based on your medical condition and how you respond to treatment. It's important to note that extended use or overuse of this medication for constipation may lead to dependence on laxatives and ongoing constipation. Overuse can also result in diarrhea that doesn't stop, dehydration, and mineral imbalances such as high magnesium levels. If you're using this product for constipation, it may take 30 minutes to 6 hours to produce a bowel movement. If you experience ongoing constipation or if your condition worsens, be sure to inform your doctor. Additionally, if you experience rectal bleeding, need to use this medication regularly for more than 1 week, or have stomach acid problems, it's important to seek medical advice. It's also worth noting that for stomach acid problems, you should not take the maximum dose of this medication for more than 2 weeks unless directed by your doctor. And as always, if you suspect a serious medical problem, seek medical help right away. If you experience diarrhea that persists or worsens, it's important to notify your doctor or pharmacist. Remember that your doctor has determined that the benefits of using this medication outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience symptoms of high magnesium levels such as muscle weakness, irregular heartbeat, or confusion. Also, watch out for symptoms of dehydration like decreased urination, extreme thirst, or stomach pain. If you notice any serious allergic reactions such as rash, swelling, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As for the optimal timing of taking this medication, it's best to follow your doctor's recommendations for dosage and timing. Before using magnesium hydroxide, it's important to talk to your doctor or pharmacist if you have any allergies or if you're allergic to this medication. This product may contain inactive ingredients that could cause allergic reactions. Make sure to discuss your medical history with your doctor or pharmacist, especially if you have kidney disease, appendicitis, or are on a magnesium-restricted diet. If you experience a sudden change in bowel habits lasting longer than 2 weeks, consult your doctor before using this medication. If you're pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. It's uncertain if this medication passes into breast milk, so consult your doctor before breastfeeding. It is important to be aware of the potential interactions that magnesium hydroxide suspension may have with other medications. It can decrease the absorption of drugs such as dasatinib, atazanavir, gabapentin, digoxin, mycophenolate, phosphate supplements, tetracycline antibiotics, certain azole antifungals, and quinolone antibiotics. To avoid any potential issues, it is recommended to separate the doses of these medications as far as possible from your doses of magnesium hydroxide. It is best to consult with your doctor or pharmacist to determine how long you should wait between doses and to find a dosing schedule that will work with all your medications. If someone has taken too much magnesium hydroxide suspension and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the Poison Control Center at 1-800-222-1222. In Canada, contact your provincial poison control center. Symptoms of an overdose may include severe or persistent diarrhea, muscle weakness, confusion, slow or irregular heartbeat, decreased urination, and dizziness. Don't miss any medical appointments and follow up with your doctor regularly. In addition to taking magnesium hydroxide suspension, consider making lifestyle changes such as regular exercise, drinking enough water, and eating a diet rich in fiber from foods like bran, fresh fruits, and vegetables to prevent or relieve constipation. For heartburn and other stomach acid problems, reducing stress, quitting smoking, limiting alcohol, and avoiding caffeine and certain spices in your diet may also be helpful. If you have any questions about lifestyle changes that could benefit you, be sure to talk to your doctor or pharmacist. Next, let's talk about magnesium hydroxide suspension. This medication is used to treat constipation. It works by increasing the water in the intestine, which helps to produce a bowel movement. This medication is also used to treat symptoms of indigestion, heartburn, and upset stomach caused by too much stomach acid. Remember to store magnesium hydroxide suspension at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless directed to do so. When it expires or is no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.